Hello, I'm Scott Edelman, the Executive Director of Burke Rehabilitation. At Burke, we are experts in the field of rehabilitation, providing the highest quality of care. This video highlights our leadership in stroke rehabilitation and the treatment of traumatic brain injuries, and how we achieve the best possible outcome for each patient we proudly serve.
Burke is a leader in neurological rehabilitation due to the patients that we treat, as well as the staff that we have here that are all focused on our patient population. Burke actually treats the most number of patients who have sustained a stroke in New York State. We have been around for a very long period of time, and we have experts in our field that are here focused on the patient and only focused on their personalized outcomes. We also have rehabilitation nursing, who are nurses with specialized training in taking care of patients with neurological conditions and helping them along their way of recovery and rehab. Our interdisciplinary team is made up of experts in the fields of physical therapy, occupational therapy, speech therapy. We also have rehabilitation nursing, social work, and case management professionals, as well as neuropsychology and neuropsychiatry consultative services. Additionally, we have dietitian and nutrition services that really want to make the personalized experience for the patient. The typical duration of rehabilitation for patients who have sustained a brain injury is truly lifelong. When patients are stabilized at the acute care hospital, they will then come to Burke if they have sustained significant deficits as a result of their brain injury. Typically, patients will be at Burke for a period of 2 to 3 weeks, which is when we are working with them and keeping close eyes on their medical condition and ensuring that they are receiving as much therapy as possible. After they leave Burke, we typically are getting our patients home with either home care services or directly to our outpatient facilities where the physical therapy, occupational therapy, and speech therapy will continue. Through the generosity of several different grants, we provide very personalized education for our patients as well as their caregivers that not only occurs in the inpatient setting, but also transitions us to the outpatient setting, where these educational models and programs are provided based upon where the patient is in their journey of recovery. Our goal at Burke is always to get our patients home. However, there are sometimes reasons why that cannot occur, and our team at Burke really works with patients and their caregivers in order to help them transition to other facilities as smoothly as possible. Our team works closely with patients and their caregivers to make sure that we are all working toward a common goal. From there, our social work and case management team works very, very closely with the patient and the caregivers to identify where the next institution or facility will be and make sure that that transition occurs as smoothly as possible. So one success story that really stands out is when a younger woman came to Burke after having had brain surgery that left her with a lot of deficits, including inability to toilet herself. She had really a lot of difficulty getting in and out of the bed, and she really couldn't walk independently. So she was with us at Burke for several weeks, and she continued to progress really, really well, had transitioned home with family members, and then over the years, as I've received Christmas cards every single year, I've seen that she has continued to progress, and she just welcomed her second child and has reintegrated back into the community working part-time. This really stood out as it was a young patient who continues to attain her goals that she had set forth when she had first come into the hospital. Success stories like this is exactly why I came into brain injury medicine and why I've dedicated my life to helping people who have sustained these types of injuries. No one ever signs up to have an injury to their brain, and this is one of the most vulnerable times in their lives. And I want to be here to help the patient and the caregivers as they progress and find their new way of life.
Burke's intensive neurological rehabilitation programs focus on maximum recovery from traumatic brain injury, spinal cord injury, and stroke.
Burke has worked on many complex brain injury cases. We are able to treat patients who have sustained a traumatic brain injury as a result of a fall or having been in a motor vehicle accident. We also treat patients who have sustained a stroke, whether it was due to a bleed or due to a blockage. We are also prepared to treat patients who have had tumors that have been removed. If it's been a patient who has become recently confused due to an infection. Also, patients who have had a brain injury as a result of loss of oxygen to their brain, perhaps during a heart attack. In short, Burke is prepared to take care of patients who have had any complex brain injury. Burke customizes our treatment plan based upon the patient's presentation and where they are having difficulties and where their strengths are. We want to be sure that we're able to treat the person as a whole. It's a holistic approach. And this is where the vast number of disciplines of professionals that interact with a patient on a daily basis really is able to work together towards a common goal with the patient in the center of our care. Burke utilizes several forms of advanced technology for patients who have sustained a brain injury. These technologies include computer stimulation, electrical stimulation for the nerves and for the muscles, as well as gait assistive technology. Burke's specialized staff and qualifications are truly remarkable and speak to our dedication to rehabilitation. Our interdisciplinary approach is based upon the interaction and communication that occurs between our physicians, our nurses, our therapy staff, as well as everyone in our neuropsychology, dietary, and case management teams. Technology is integrated into the rehabilitation process at all different aspects of their rehabilitation course. This will include appropriate technologies in structured therapy sessions, but also we want to try to translate that to when patients are in their rooms or interacting with their caregivers so that they're getting more out of their rehabilitation course. The goal at Burke is for all of our patients to return to their life and have a quality of life for which they are proud of. We want to help them along this rehabilitation journey every single step of the way.